The first question I will hand over to Christian was, have you ever made a recipe from a food bank hamper in your program?
Oh, yes. In fact, maybe not so much in Boost, but in the drop-in community kitchen. That was one of the things I sort of started from, because I knew that several of the participants were also accessing the food bank. And to be fair, the stock food bank is very different from most food banks. So people are accessing fresh vegetables and produce. So that's a little different, but definitely I tried to keep typical things like canned beans, maybe something like that, and keep the meals under a cost of, say, $5 for a family of 4. And people perk up when you start talking about what it costs and how much this compares to other food, what kind of nutritional value you're getting from that. That means a lot to people.
Yeah, and I think one of the things we hear from our participants a lot as well is the stress of not knowing where your next meal is coming from, or whether you'll have enough food to make a healthy lunch for your kids the next day at school. So access to food, let alone food skills and building confidence in food choices, can be a huge changer in people's mental health and well-being as well.
And how to have some variety. If you're getting the same types of food and your cupboard is limited, then you want to be able to have some variety, and also to make it a little healthier. You want to be able to do that. Great.
Got another question. How do you sell nutrition for anxiety when doctors are often willing to dole out fast-acting medications such as benzodiazepines? I'm going to ask this question to Karen about, when we traditionally reach for the quick fix, which can often mean medications. How do we sell nutrition as a support or a complement to the healthcare that's traditionally offered to some people that are struggling with mental disorders?
Well, certainly nutrition is, along with medication and psychotherapy, is an important cornerstone of treatment for mental health. And if you think at just the very fundamental level, I mean, all of those drugs, any kind of drug that's used in the body, does require nutrients in order for them to be metabolized or used by the body. And so there's a number of different interactions that can occur between nutrition and drugs. And I think raising that profile of the different interactions. So there's drug-nutrient interactions where the drug actually can reduce the bioavailability of the nutrient. Conversely, someone's nutritional status can affect how both the drug and nutrients are metabolized. And so, oftentimes when we think about the different psychiatric medications, for example, that's where you need to kind of get into specialized nutrition care and really looking at, say, what medications they're taking, as well as other medications they may be taking for other conditions they might have, and looking at their context, and then determining, is diet enough? So are they able to, say, get enough folate from their diet to address their heightened needs, say, that the medications might create? And so that's when, of course, you might look to supplements in order that they get all of those different nutrients in adequate amounts that's going to optimize their mental function.
Are you finding that with this emerging evidence around the benefit of healthy eating with helping to manage mental health conditions or offset the side effects that some of the medications can bring on, for you or your colleagues who are dietitians, do you find that you're getting more referrals from physicians and mental care practitioners?
Certainly, yes, more referrals. Unfortunately, there's not always the service level at our end or the capacity to address all those referrals. But certainly there is this increasing acknowledgement of the role of the dietitian. And just going back to, say, talking about the medications, I mean, one of the important or side effects that can happen from some of the medications, particularly the antipsychotics, is weight gain. And so, making sure that once that person starts on that medication, that they get access to nutrition services that's going to minimize that side effect. Because once you get into weight gain, then that further impacts someone's mental health, and then you kind of get into this vicious cycle. And so certainly early referral is very important in those circumstances.
Great. Kristen, have you had any medical doctors that have called and inquired about some information about your program?
all kinds of people want to know about the program, and a lot of times it's actually really popular in the social service sector. A lot of people are trying to refer clients or want to come themselves and want to train their staff. They want to have their staff know a little bit more about food and mental health.
Good. And the last question that we're going to take from the webinar participants is, how do you engage low-income and formerly homeless populations when, one, folks lack access to a kitchen, and two, public health precautions exist that prevent people from participating in the preparation of their own meals? So, Kristen, you mentioned that you have some participants that come from group housing situations or have limited.
Yeah, some people are living in shelters. Yeah. So, I mean, I think the thing to remember is just because a person is living in a situation where they may not have access to a kitchen or may not be able or entitled to cook their own meals doesn't mean they don't have food skills. It doesn't mean that they have never done that. Often you have people who have raised families, raised children, and now they're at a point in life or in a situation where they don't have access to those things anymore. Having the chance to be in a kitchen with other people is really wonderful. And at least for us, the way our kitchen operates, it's inspected by the Toronto Public Health. And we have guidelines we follow. There are very few rules, really. There's safety and their health guidelines that we follow as a group. And there's nothing really limiting anyone else. As long as I have a food handler certificate and I am ensuring the rules are being followed in the kitchen, it doesn't matter. We put our hair up, we put on hair nets, we wash our hands, we wear gloves and aprons, we follow those guidelines, and anyone can really join the group and work together. Right?
Yeah, and I think as well that the knowledge that people learn around nutrition and making healthy food choices, even in the days when they're not there, where they can't cook their own food, when they're making food choices, or they can say yes to some things and no to some things because of what they've learned in the programs, and that can help them into their day-to-day life, whether they can prepare their own food or not. So.
And sometimes they share their recipes with the house staff where they're living, or the group home where they're living, or with the dietitian at the hospital.
Oh,
say, we made this, it was really good. Can we make it together? Great.
Yeah, and voicing, if they're not seeing the foods that they know can help them in their life situation, perhaps it gives them some voice and confidence to get out there and make some changes in their lives that they may be able to influence. That'd be great. All right, just as we're wrapping up, I think what I'll ask Karen and Kristen, just one final question. We'll start with Karen. For any dietitians who are on the call, what would be one or two really key points that you would make to help them kind of implement nutrition and healthy eating and mental health, and bringing it all together in that scope of practice?
Okay, so a couple of points I think to convey to other dietitians would be that acknowledging the individual and acknowledging that the symptoms that they may be dealing with, for example, if they have a mental health condition, can be very difficult. Also acknowledging the history and the context around the person and their living situation. And by looking at all those different factors, considering them and sure, the aim is healthy eating, but that there can be a long road ahead in terms of getting them to that point, and acknowledging that you have to address all of these factors. And the other important component is to, one thing that I haven't really mentioned is this peer counseling approach. And so really, it's great for the person to come in and see the dietitian, but a very effective model is to convey that information through someone that the person can connect with, someone that's been through that lived experience that they've been through. And so that peer would have the specialized knowledge and training from, say, a dietitian about nutrition and the factors that affect it, and can work with that person. So it may not be a direct connection with the dietitian, but also looking at these sort of models or ways of intervention.
And Kristen, what advice would you give to someone who's looking to start a community-based program or linking food with mental health, from what you've learned in your programs?
Be flexible, keep your sense of humor, be inclusive, demonstrate respect and dignity, for the people that are going to come, because anything can happen when a group of people comes together to try to make a meal and enjoy it, and it can be quite magical. So allow for that. Allow yourself to be surprised.
Great. I'd like to thank Karen and Kristen for taking their time today, for sharing the information that they're bringing to the table, both from the research end and from implementing programs on a community level. Thanks again. Have a great day. And until next time, eat well and be well.